Every minute, approximately 250 children are born across the world. They come to a world full of life-threatening organisms. In the coming days and months, modern medicine in the form of vaccines will be their first line of defense against life-threatening diseases. In Kenya, vaccination has been one of the most successful and cost-effective public health interventions. In Narok County, the immunization story is intertwined with that of the local communities. The Narok County government has made notable efforts to improve access to health and immunization services through investment on infrastructure and healthcare workers, as well as on vaccine commodities.
Kuna watoto wa 7 na wengine walipata chanjo huko Olme Kenya na wengine walipata kwa hapa. Watoto inashikwa na wagonjwa mbalimbali. Sasa ni vizuri kupata chanjo.
Serikali inatumia wala wa kijana alikuwa anakujanga tuseme kama mwezi moja ama mwezi mbili kuhudumia sisi kwa nyumbani. Anatupatia dawa, anapatia watoto dawa.
In terms of immunization, as you are aware, the target is to I mean, our target is about 73%. However, by last year we were at 66.2. In this year we are at 68. And therefore, we feel like we are gradually improving in terms of our targets.
While there has been substantial improvement in immunization uptake in Narok, there are people whose access to immunization services is limited by geographical factors, culture, and financial difficulty. As a result, the county missed out on the intended immunization target for the year 2020, only managing 64% coverage against a target of 72.2%. It is evident that an unacceptable large number of children still miss out on life-saving vaccines.
Niko na watoto 4, lakini kuna moja mwenye alifariki. Hapa kulikuwa na outbreak ya measles. Sasa kwa sababu unajua hapa tuko na shida ya nini? Kupata matibabu ni shida sana. Saa tulikaa tu, alikuwa tu for 1 week. Sasa nikatumia nini? Zile midi za kawaida za kienyeji. Baada ya kusaidika, alikufa tu.
The planned progressive withdrawal of funding by multilateral funding institutions for vaccination initiatives in Kenya, and by extension Narok County, further aggravates the situation.
Immunization financing in Narok County is mainly through the international donors, accounting to around over 80% of the funding in this county. And based on what we are seeing all over the world, the reduction in funding from donors, we envision a scenario where we may not have the funding for immunization.
Once our current donors withdraw, we shall actually suffer the risk of having many children who are not immunized. And once that cohort is builds up and increases, we shall have a risk of having outbreaks of diseases like measles and even pneumonias.
There's a cost associated with the vaccines, so that one will be definitely affected. There is also the area of logistics. That means the vaccines will not be able to reach to that child in the rural health facilities. So it will be very, very, very big challenge. The logistic will be entirely affected.
Community Health Partners, CHP, has been leading efforts to sensitize communities in Narok on the need to sustain the gains made so far on immunization. Together with other civil society actors, they have been advocating for alternative local funding avenues for the immunization program.
So we build the capacity of the champions at the community level. Each champion attached to a health facility, they engage the communities in their household level, and they follow up to the health facility so that when each health facility is budgeting, they take into consideration immunization as a key budgeting item. Then from there, we are able to follow up at the sub-county level, where the Ministry of Health follows up with that data collected at the health facility, combining it at the sub-county level. There we also have champions who also follow up to ensure that the issues raised at the health facilities and at the household level are taken into consideration. This also goes up higher even to the county assembly, where we engage the budget committee. We train the budget committee and engage them to ensure that they include the budget items in the county budget estimates for every year.
Nimekuwa nikisunguka maboma kwa boma, ama saa zingine nikisikia mahali mkutano iko, naenda naongelesha hawa ili tuongee kwa serikali ya county ili tuweze kupewa haki yetu ya immunization kwa hospitali. Kama wanaweza tenga pesa ndio tupate immunization kwa watoto.
We've been engaging the County Assembly Health Committee and the Budget Committee, and I'm happy to report that we've come up with a budget line. For this financial year, what was approved is about 15 million. However, since there's a supplementary coming up, we hope to increase our allocation to about that million, and increasingly in the coming years to increase our budget allocation.
After years of collaboration, learning and progress that has brought promise to the childhood of many and a new hope to parenting, the next milestone for the county government of Narok is to progressively increase local funding for this critical service to our people as a way to secure its continuity.
To play a key role, because you understand issues of health, it is a devolved function from the national government to the county governments. So we have a key role. And also we are not just have a key role, but also we are also making sure immunization is a factor, rather is an item that sits alone in our budget for resource allocation.
If we have this withdrawal of donors happening without proper interventions to make sure we bridge that gap, then we are going to have catastrophes amongst the communities. So mine is really to request and to plead with our governors, not just Narok, but this being my county, I would be saying Narok, is that we have to rise up and, just reorganize our priorities, because this is a huge priority that we must take on.